Yeah, awesome. Everybody, Jim Karinji, and I have, as I've said every week, I think I have the honor of organizing this seminar with Dr. Chase Begay. Um, Today we have four rock star students. I can say I either have them in class or I've had them in class, and they're all awesome. So it's going to be great presentations today for sure. Also want to make an announcement that our rescheduled seminar for a few weeks ago when APHA was happening. We had a tech glitch, and Steve Schmidt is with us right now. I see Steve. How you doing, Steve? Thank you. And we're going to have Steve presenting on the 16th of December. So we're really excited that that worked out for us to happen. Thanks for your flexibility, Steve. And at this point, I want to turn things over to Professor Lee Taggart and our students.
Thanks, Jim. Thanks, everyone. Welcome to the second cohort of the Applied Practice Experience presentations. And we have four students presenting today. I'm just going to make a few housekeeping notes. So hold all your questions to the end of the presentations. If you do have a question, you can always put it in the chat, and I'll be monitoring that and making sure that everybody gets a chance to ask their questions to this amazing panel. So our first presenter is Shae Bruursema, and Shae did her practicum with the Montana Department of Transportation with Sheila Causey as her site mentor. And the name of Shae's presentation is Collaborative Strategies for Enhancing Youth Traffic Safety in Montana, a Public Health Approach to Peer-to-Peer Education and Vision Zero. So Shae, if you want to share your screen and take it away.
Okay, hello everyone. It's great to see you. I'm excited to be here today, and I'm excited to share collaborative strategies for enhancing traffic safety in Montana, a public health approach to peer-to-peer education and Vision Zero. So traffic safety isn't just a transportation issue, it's a public health challenge, and every injury or fatality on Montana's roads represents a preventable tragedy. And by adopting a public health lens, we can address the root causes of risky behaviors, promote safer practices, and ultimately save lives. So through my APE, I've been working with the Montana Department of Transportation, or MDT, whose mission is to plan, build, operate, and maintain a safe, resilient transportation system to move Montana forward. So this mission isn't just about roads and bridges, it's deeply connected to public health. And a safe transportation system reduces traffic injuries and fatalities, ensuring reliable access to healthcare services, and supports physical activity by promoting bike and pedestrian infrastructure. So MDT prioritizes safety, innovation, and public service, reflecting its commitment to creating a system where Montanans can travel efficiently, regardless of their chosen mode of transportation. My site mentor, Sheila Causey, exemplifies this mission in action. So she's the cultural liaison, program manager, and transportation planner, and Sheila works at the intersection of community engagement and program development and planning. Her work aligns transportation strategies with the needs of Montana's diverse populations, emphasizing equity and safety, key components of public health. Another key player throughout my applied practical experience has been Montana Family, Career, and Community Leaders of America, or FCCLA. So FCCLA is a student-led organization that empowers youth to tackle important societal issues through hands-on projects that promote leadership, life skills, and community involvement. With its focus on developing young leaders, FCCLA helps its members make positive, lasting impacts in their communities while preparing them for future roles in society. So the partnership between MDT and Montana FCCLA formed in 2016 in response to increasing traffic safety fatalities and the need for targeted solutions. Because FCCLA's mission and programs align so well with MDT's goals, this partnership leverages both organization strengths to engage youth in peer-led initiatives aimed at promoting safer driving behaviors. So through this collaboration, Montana FCCLA chapters gain access to essential resources, funding, and data from MDT. MDT has actually provided over $160,000 in grant funding to Montana FCCLA to support their traffic safety projects. So these funds help students develop and implement initiatives such as media campaigns, curriculum materials, and guest speaker events. So by combining the strengths of Montana FCCLA and MDT, this partnership creates a powerful platform for students to not only promote traffic safety, but to also play a central role in creating a culture of safer driving in Montana. So the goal of working with the two organizations has been to revitalize their partnership and to continue to get students excited about creating their own peer-led initiatives to achieve Vision Zero in Montana. So I had to create products to help do this. My first product was to create and update the Teens in the Driver's Seat manual located on the Montana Department of Transportation website. So this manual has been turned into the Montana FCCLA guidebook to Vision Zero and is revamped to incorporate the most current data on teen traffic safety, ensuring that it reflects the latest trends and statistics. The updated manual is also specifically tailored to meet the needs of FCCLA chapters across Montana. It takes into account the goals and mission of FCCLA, ensuring that the content is relevant and applicable for students who are leading peer-to-peer traffic safety initiatives. A key feature of this updated manual is its alignment with the FCCLA National Program FACT, or Families Acting for Community Traffic Safety. So by connecting the manual's content with FACT, it provides a seamless integration for students to develop and lead traffic safety projects that align with both local and national goals. The manual also includes a section that breaks down the grant application process, emphasizing ease to eliminate any barriers to the grant funding. My second product was a workshop that I offered for program design assistance. And in this workshop at the Montana FCCLA Leadership Rally, I introduced that guidebook to Vision Zero. It was also a great opportunity to engage with students and advisors directly, ensuring that they were equipped with the resources needed to take action in their communities. So in addition to introducing the manual, I also provided step-by-step guidance to help chapters develop their own traffic safety initiatives. It walked them through the process of identifying local traffic safety issues in their own communities, creating relevant campaigns, and then executing the projects that align with both FCCLA's mission and Montana Vision Zero goals. My next product is what I like to call Workshop in a Box, but it's a ready-to-use workshop that's focused on teaching effective peer-to-peer education in traffic safety. So the goal of the workshop was to equip students with the skills and tools they need to educate their peers about safe driving behaviors in a fun and engaging way. And the workshop in a box includes a PowerPoint presentation, printable materials for activities, and a detailed script with step-by-step instructions on how to facilitate the workshop. So the design of this product allows it to be easily picked up and conducted by any FCCLA chapter with minimal prep time. These materials were available to the FCCLA state officers so that they could share them at their district meetings across the state. And in addition to making these materials available to the chapters across the state, I also personally presented the workshop at 2 of the meetings this fall. My final product was my presentation at the annual traffic safety meeting. So this presentation provided a summary of the outcomes from the ongoing partnership between MDT and FCCLA. It highlighted the successes of the collaboration, emphasizing how student-led initiatives are making a real impact on teen traffic safety in Montana. And during the presentation, I also shared policy-relevant data that's essential for safety officials and other stakeholders. So this data not only demonstrated the effectiveness of peer-driven traffic safety efforts, but also supported the importance of continued collaboration between MDT, FCCLA, and other community partners. So throughout this project, I demonstrated the ability to assess population needs by understanding the specific traffic safety challenges faced by teens in Montana. I applied epidemiological methods to analyzing traffic data to guide the development of my products, collaborated with key stakeholders such as MDT, local FCCLA chapters, and community members to build coalitions and advocate for policies that support traffic safety. I ensured the cultural relevance of my products by considering Montana's diverse communities, particularly the rural areas, when designing my resources. And then I worked to develop strategies for peer-to-peer education, aligning my work with Vision Zero, and using resources effectively to promote public health and safety. So this all helped me contribute to improving public service delivery and community health outcomes, all while supporting youth leadership and development. So while working on this, I definitely faced several barriers and challenges, but one of the key challenges was simplifying the complex traffic safety data for teens. The information that I needed to convey was often technical, and it was important to present it in a way that was accessible and understandable for a teen audience. Another challenge was breaking down the FCCLA materials in a way that made them easier to navigate. So FCCLA members and advisors needed clear, actionable steps to implement the traffic safety projects effectively. So I worked to simplify and streamline the information while maintaining its depth and relevance. Additionally, there was some pushback from the Montana FCCLA Board of Directors on simplifying the grant application process. So the goal was to make it easier for chapters to apply for funding, but it was also important to ensure that the process remained rigorous and aligned with the program's objectives. There were also some unexpected surprises. One of the most rewarding surprises was the enthusiasm and dedication I saw from the students. Many FCCLA members were already passionate about traffic safety and wanted to take on leadership roles in their community. Their motivation exceeded my expectations, and it was inspiring to see them take ownership of the initiatives and truly want to make a difference. So despite those challenges, the support from MDT, FCCLA, and local communities was invaluable, and I feel proud of the work that we have accomplished and are continuing to work towards. And as a cherry on top, the number of grant applications to conduct peer-led traffic safety initiatives across Montana has already increased by 6. So last year they had 5 grant applications, and we are at 11 so far this year. To wrap things up, just some key takeaways. The first is peer-to-peer education is incredibly effective for teen-focused initiatives in Montana. Teens are just more likely to engage with their peers and trust them, which makes them powerful advocates for safety in their communities. Second is partnerships, such as the one between MDT and MTFCCLA, amplify community impact. When organizations like MDT and FCCLA work together, we can leverage resources, data, and expertise to create more effective programs that benefit communities across the state. And finally, public health approaches are essential in addressing the unique regional challenges we face. So Montana's vast geography and diverse communities require tailored solutions. And by applying public health principles, we can address these challenges in a way that are both inclusive and effective. And looking down the road, it's crucial to continue strengthening engagement with all stakeholders, so youth, educators, community leaders, and policymakers. And our ultimate goal just remains the same, achieve Vision Zero. So continuing to work together, we can definitely make Montana's roadways safer for everyone. Just thank you for your time and attention, and thank you to Sheila and MDT. It's been an honor to share the work I've done in collaboration with them in Montana FCCLA to enhance traffic safety through peer-to-peer education. And I'm grateful for the opportunity to contribute to this important initiative and be part of the work towards achieving Vision Zero.
Great, Shae. Thanks very much. Nice job. All right. So our next speaker is Cristina Chiotti. And Cristina did her practicum with Carrie Jo Reagan, who is an evaluator at the Center for Children, Family, and Workforce Development. And the name of Cristina's presentation is St. Peter's Health Impact Study and Housing Evaluation Project. So take it away, Cristina.
Alrighty, thank you so much, Lee, for the introduction. Thanks everyone for being here and for sharing this opportunity to present about my time with the center. So I did my APE with the Center for Children, Families, and Workforce Development based out of the University of Montana in Missoula. And the center essentially works to improve the health of Montanans through sort of 3 main streams. So workforce development and training, research and evaluation, and capacity building and technical assistance. I actually also completed my integrated learning experience with the center as well. So I've had the great pleasure and an opportunity to be with them since about June, I want to say. And throughout that whole time, Carrie Jo Reagan has served as my site mentor, and Kristen Rogers, the director for research and evaluation, has served as sort of a secondary mentor. So for my APE, I focused on sort of 2 distinct areas. So the St. Peter's Impact Study and then the housing project as well. Not pictured here, I also worked on an annotated bibliography for the St. Peter's Impact Study. I didn't include it here as it was quite lengthy and I didn't think everybody needed to see all the pages of that, but that was part of my ILE. So this has all kind of been an extension since June of my work with them. For the housing project, which is ongoing now, I've been working on the coordination and sort of general data collection and logistics of that. So overseeing the communication with the contacts at each housing site, scheduling the focus groups, and then helping to conduct those as well. So the St. Peter's Health Fuse program, so this is part of a grant-funded project called Housing is Healthcare. And this is a community health worker intervention program that helps people who are unhoused or unstably housed, who often use the emergency room or other forms of crisis care at a disproportionate amount. The goals of Fuse are to increase housing and retention, decrease inappropriate utilization of emergency room and other crisis systems, improve chronic disease management, and to advocate for generally a more appropriate care. Like I said, the annotated bibliography that I did as part of this was an overview of the literature on community health worker programs. In collaboration with St. Peter's Health, the center conducted an evaluation for the Fuse program, and pictured here is a background section that I contributed to the evaluation plan. And this background section essentially looks at the strength of community health worker programs on improving health outcomes, specifically those related to housing insecurity. The most recent project, and something ongoing that I'm happy to say I'll be staying on with the center to work through the spring on, is a housing project. So pictured here is a flyer I made for the housing project. So a little bit of context and background for this. So in collaboration with the Department of Commerce, the center was contracted to conduct an evaluation for a housing gap financing project, which looked at the role that state and local recovery funds played in improving outcomes for Montanans who were disproportionately impacted by the COVID-19 pandemic. So part of that evaluation includes conducting focus groups with residents of the different housing sites that received funding from the project, which have been the main focus of my semester work with the center. So this flyer here I created, and it was used to recruit participants from each housing site. I want to say there's 13 housing sites total. So property managers all received this flyer. Were asked to put this up and distribute it to recruit participants. Participants then would reach out to me via email or cell phone, and that would just help me track and organize participation. You can see, I think at the bottom there, the flyer here went through IRB approval. So I had some experience helping draft the IRB application with Carrie Jo and submitting all the various pieces for that. So that was a great learning experience in not only kind of specific marketing for public health for something like this, but going through the IRB approval process, which was different and new to me. Things that I had to consider were largely the demographics of the participants. So would folks have access to email or phone number, making the content accessible for them as well, being sure to include all the relevant information. And then, like I said, going through that IRB approval. So making sure everything was up to the standards that we needed for that as well. So this here is a snapshot of the focus group guide that was used for the focus groups themselves. So I helped draft questions and then collaborated with others in the center and on the project to sort of finalize questions for the focus group, ultimately resulting in this guide here. We also created a guide for interviews that we're conducting for property managers and owners and developers as well, who will all receive some separate opportunities to give input into the housing project. This was my first experience running a focus group, so it was useful. It's been useful to have a guide and have something to kind of help keep me on track and stay organized, and also to make sure that all the information is consistent across all the multiple housing sites. So a couple of the questions that you can see are listed here, an idea of kind of what we're getting at with the focus groups, asking largely about resident satisfaction, description of on-site management, so what do or don't you like about the on-site property manager, and then getting at a couple of things related to health and well-being outcomes. So essentially, how has living in this housing site impacted your health? How has it impacted your employment outcomes? Things like that. So an overall review of my experience so far, like I said, it is ongoing, and I'm really happy and grateful to be staying on through the spring. A couple challenges, surprises, and successes. The biggest challenges for me were just, frankly, imposter syndrome and not feeling like I would be able to do the work, and that I was even suited to do the work. It's been a very long time since I've had an internship in college, and so this was kind of a unique experience in that, and I was certainly nervous. Very different and distinct from doing the ILE, even though it was with the same people. This was, an opportunity to go in person and conduct focus groups and kind of work more interprofessionally and collaboratively with folks who are respective experts in their areas. A little bit nervous too when I started about remote work. That's not usually where I thrive. I usually, even in person, do a lot better with kind kind of all levels and aspects of my work, including presenting. So remote for me was a little intimidating. Juggling the multiple demands, so working full-time, having classes to maintain and manage, doing the internship, I was a little concerned that maybe I was putting too much on my plate. And then challenges kind of ongoing with the focus group, just because it's something new that I haven't done prior to this experience, navigating, a bunch of people, reaching out and trying to coordinate, and just being that one point person to try and plan everything and make sure everything goes to plan. So that's been challenging, but also a really good learning curve of kind of how to manage all of those aspects. Some things that surprised me is that I actually really enjoy the remote work that I've been doing, and the flexibility and kind of navigating what comes with doing remote work and having to hold myself accountable and stay much more on top of my time management. I've also really enjoyed getting to see all these folks under the kind of general umbrella of public health, but in their respective areas of expertise within that. Even just sitting in on meetings and hearing different perspectives based on, so-and-so's area versus the others. So that's been really helpful for me to see how that interprofessionalism comes into play in a real setting. And the logistics of data collection, it's been very cool and meaningful to actually see kind of from the inception, or a little bit after the inception of something, through that entire project and actually be executing and conducting that work. So that's been a really awesome experience to be a part of that. And the successes, I've gained a lot of experience, gained a lot of confidence, working with the center. Like I said, I had never done IRB anything before. So that was a great new experience to obtain, getting a little bit more in-depth experience with research and contributing to sort of these larger state-funded research projects and data collection projects has been really significant for me, and something that I otherwise don't know when or how or if I would have gained those experiences. And then I want to call out the mentorship and support that I've received has been really, really significant and meaningful for me during the semester. The center and Carrie Jo and Kristen and others that I've worked with have been really just exceptional at providing support when I need it, but also giving me the opportunity to kind of branch out and try things on my own first, and always giving me the opportunity to try and see how it goes, and then reach out if you need help, while also always being there if I need anything and providing a lot of great feedback. So that experience in itself has been really awesome and super valuable for me, and very excited to continue that work through the spring with them and kind of gain some more through that. Going over some of the competencies that I met through my time with the center this fall. So I've listed out the competencies here, and largely these were met through either the background section for the impact study, or through any kind of all levels of conducting the focus group. So the planning and logistics of it through actually conducting those focus groups. So looking at things like selecting methods to evaluate public health programs. So achieving that through focus group questions and developing those guides. The second competency there, selecting appropriate data collection methods, achieving those again through the experience with focus group questions and actually conducting those focus groups and interviews. The next foundational competency of communicating audience appropriate public health content, the background section for that FUSE evaluation plan, fulfilling that competency and just knowing who I was writing for and to. And then my last foundational competency of performing effectively on interprofessional teams. I spoke to that a little bit already, but just getting to work on a team of folks in their subject matter area of expertise, and also having to work with people through these focus groups from very different backgrounds and different areas was a great experience for working kind of with different backgrounds of people. And then finally, my concentration-specific competencies, so gathering, integrating, and analyzing health data, achieving that largely through those focus groups, involving multiple people from different projects and different types of residents and property managers, as well as the involvement in, the demonstrating basic understanding and respect for different values. And again, so those focus groups being that opportunity to work with people from all different backgrounds, as well as working with folks from the center coming from different areas of the public health field. So I'm excited to continue my work with the center. Thank you so much for listening, and I look forward to any questions at the end.
Thanks, Cristina. Great job. All right. So our next presenter is Greg Sheumaker. And Greg did his practicum with Janet Trethaway, who is with DPHHS in the EMS and Trauma Systems Office. And the name of Greg's presentation is The First Link, Participatory Assessment of Telecommunicator CPR, TCPR, in Montana, Public Safety Answering Points, PSAP. So this one has all kinds of acronyms. So Greg, I'll let you explain all of it. And so take it away. Oh, I think you're muted, Greg. Yep, you're muted. So just unmute yourself. Start again. There you go.
Thank you, Lee. Thank you, everyone, for being here. Yeah, my name is Greg Sheumaker. This needs assessment started as a beginning dialogue between public safety and public health services. Public safety answering points, or PSAPs, are typically housed under public safety entities such as sheriff's departments, city law enforcement, tribal law enforcement, or other emergency entities. As such, primary duties and daily activities are centered around police activities or emergency services, especially in Western Montana. PSAPs are also known as 911 call centers that receive and dispatch emergency calls. When somebody calls 911, the call is routed to the appropriate PSAP based on their location. They are the first point of contact during emergencies such as cardiac arrests. Telecommunicator CPR, or TCPR, is a program where trained 911 dispatchers give CPR instructions over the phone to bystanders. It's a critical link in the chain of survival, providing guidance during out-of-hospital arrest incidences. The study focused on Montana PSAP centers to evaluate and compare their readiness for implementing and executing TCPR protocols. This includes current laws, regulations, internal performance, available resources, and current standings. During the assessment, I was mindful of potential biases from both myself and the respondents. I took care to design questions that were open-ended and non-leading to ensure that the feedback collected was genuine and reflective of the participants' true experiences and their opinions. Additionally, I made sure to include the entire PSAP group of respondents to capture a wide range of perspectives and minimize the effects of any unconscious bias. To further alleviate the bias, responses were de-identified, anonymous, and an analysis was conducted to identify any patterns. I utilized a mixed method approach to balance qualitative insights with quantitative data, ensuring a complete understanding of the feedback. I was diligent about recording in a systematic manner that utilized statistical tools supporting the findings, ensuring accuracy and reliability of the results. I've conducted periodic checks throughout the process to make sure make necessary adjustments based on the feedback from the participants and maintain a data collection process throughout the assessment. My site mentor is Janet Threshaway. She has worked in many roles at the Montana DPHHS and extensively on high performance CPR, chest pain identifications, stroke recognition, that all contributed to improving patient care to EMS agencies and critical access hospitals. For the project, I worked with the Institutional Review Board to ensure the protection of the participants' rights and the well-being throughout the process. Working was a great experience that ensured the ethical standards and compliance with regulatory requirements. The needs assessment was given an exempt decision, noting the need for de-identifying the data and the participants. Emails were sent out to 53 PSAP centers across Montana with information about the assessment, the anonymous reporting, and the timeline. Participants were provided with informed consent forms, as well as a link to a survey on Qualtrics. The Qualtrics survey inquired about the qualitative data with yes and no questions and some numerical questions as well. Also, qualitative questions were asked with open-ended and personal comments. 19 PSAP centers responded with consent, 1 declined, and 1 did not complete the survey. Collected results were coded using Excel, analyzed, and used to create various media and data tables. Respondents were able to be evaluated and compared for trends, needs of continued needs of the area, and opportunities for growth. Community themes emerged from the data set, suggesting a diverse demographic, but a common goal. The diverse sizes of the PSAP centers can be seen in the graph. While 2 PSAP centers seen over 250 cardiac arrest events per year, most of the centers received around 20. Some PSAP centers noted issues with legal limitations in the facilities that do not allow them to provide medical assistance over the phone. They suggest issues with authorization by their governing bodies, issues with certifications, and limited training to contribute to them not providing any instructions. Dispatchers who do not have certification in emergency medical dispatching are not allowed to provide instructions, which includes TCPR. While the number of cardiac arrest events varies from PSAP to PSAP, not every event receives TCPR instructions. This could be due to a variety of reasons, such as a cardiac arrest without a long downtime, or no person is willing to provide CPR. Dispatchers are required by Montana administrative rule to complete TCR training every 2 years, but only 26% reported not being able to have all dispatchers meet this requirement. Issues noted include workforce limitations and high staff turnover as the main reasons for not being able to meet the state rule. The high cost of training, computer programs, and equipment also were notable as issues with providing TCPR. Geographic remoteness was frequently noted as restricting some centers' access to training opportunities, and participants highlighted that there was an absence of a specific certification pathway for TCPR despite the legislative demands. Resources and workforce limitations highlighted by a high staff turnover and a shortage of trained personnel complete efforts to maintain a consistently trained workforce. This turnover requires continual training, putting additional strain on the available resources. Like most places, PSAP centers have operational challenges, particularly among small agencies with limited staff managing multiple calls and balancing workloads, alongside a unique community dynamics like a reliance on some using personal transport from patients to hospitals. Caller management emerges as a significant hurdle where dispatchers must communicate clearly with distressed callers to ensure CPR is performed effectively, countering obstacles in coaching techniques and managing caller emotions. Resource limitations such as having a sole dispatcher on duty are a recurrent issue, compounded by concerns of physical inadequacies when performing CPR. Ongoing challenges with ambulance service collaboration and the absence of formal agreements further highlight a pressing need for structured communication frameworks to facilitate better outcomes and feedback loops. Part of TCPR is ensuring the system is working correctly and challenges are being overcome. However, a small portion of PSAP centers have systems in place to review events involving TCPR. Agents often employ both formal programs and informal reviews led by senior dispatchers to analyze cases and make informed decisions. Of them, 37% provided feedback to their dispatcher of the events, but 37% also provide no feedback. Barriers exist on both sides of public safety and public health with interagency collaboration. Public safety is an example. Public safety, for example, has restrictions from the Montana Criminal Justice Information Network that restricts information disclosures. PSAP centers responded to the survey with numerous challenges and issues. The foremost theme being reported was feedback services and access to training. One PSAP center reported the job as drinking from a fire hose with the numerous duties and workloads. Participants encouraged policy recommendations and training programs that address gaps and foster a more robust emergency medical dispatch framework across the state. Training services need to be increased to ensure all personnel are adequately prepared to handle the high pressure of the demands of their roles. This includes developing training modules that cover all aspects of TCPR and provide hands-on scenario-based learning to enhance decision-making skills. Collaboration should be encouraged with other emergency providers to ensure the best practices are shared and that a joint exercise can be conducted to improve coordination. PSAP centers should participate in data collection services such as the cardiac arrest registry to enhance survival, which is called CARES. However, none of the participants currently contribute to the database that is intended for communities to compare their performance and identify areas in cardiac arrest survivals. The study presented data on various challenges faced by providing TCPR by PSAP centers. PSAP managers described their jobs as overwhelming and stressful. There is significant need for improved and increased training services to ensure personnel can meet the high pressure demands. Participants suggested developing policy recommendations that would address current gaps in training and services while prompting a united emergency medical dispatch framework statewide. There's a need to encourage enhanced collaboration between PSAP centers and other stakeholders to create a network that ensures efficiency and effective emergency care. This also highlights the importance of enhancing feedback services in the PSAP centers and beyond. Better resource allocations would provide PSAP centers with the necessary tools and technology to build a capable system handling the diverse challenges encountered during emergency situations. I would give a thank you to everybody for your time, and I'll turn it back over to you, Lee.
Thanks, Greg. Thanks very much. Super interesting work you've got going there. And I think we're up to our last presenter. Last but not least, Reagan Mecham. Mecham, is that correct? Okay, phew. So we're pulling this full circle back to youth drivers in control. Young drivers in control is the name of Reagan's presentation, and she did her practicum with Steve Schmidt, who's with Drive Safe Missoula. He's the coordinator at Missoula Public Health. And I will let you take it away, Reagan.
Awesome. Thank you. Great. Well, thank you so much again, Lee. Again, my name is Reagan Mecham. I'm in the MPHPA program with one semester left to go. And I want to thank each of you for being here today. I know my classmates and I really appreciate you being here and your support. So for my applied practice experience, or APE, I had the privilege of working with my site mentor and colleague, Steve Schmidt at Missoula Public Health. Steve is the coordinator for Drive Safe Missoula, which focuses on traffic safety in Missoula County. This includes DUI prevention, seatbelt education, advocacy, car seat safety and installation, and so much more. Steve is truly a rock star in this field, and it's been a privilege learning from him this semester. For my practicum, I worked with Steve on his Young Drivers in Control program. Young Drivers in Control is not a driver's ed curriculum. Instead, it is a supplemental program for driving-aged youth that takes a unique approach of educating youth on how being a safe, responsible driver actually gives them more control on the road. Prior to joining this project, Steve made 9 incredible video modules, each discussing different topics that involved the concept of control. And my job was to utilize these videos and AI to create 3 different study guides, one for students, parents, and educators to create a comprehensive learning environment. I also made pre and post module questions and wrote elevator speeches for each module. Just for some background, I reached out to Steve first when I learned about the APE because I'm so impressed with his use of integrating AI and public health. I wanted to learn how to do that with my own program and become more comfortable with using AI. And fortunately, I think I did that, although I have a lot to learn. AI is amazing. He and I met multiple times this semester for him to teach me how to use AI, and I won't lie, at first, I totally felt like in some way I was cheating, and I shared that concern with Steve. And we had a great conversation about how using AI and incorporating our knowledge of public health can actually create something that is more innovative and effective than if we did it on our own. Steve also taught me that there's a very specific way to talk with AI to generate what we want, and we can only do that if we have an idea of public health principles. He also taught me that using AI can save a significant amount of time and money, and this was evident in the work that I did with my APE. To be completely honest, there's no way I could have made these 3 guides and the questions on my own in a single semester at this high of quality and at a level that each of these audiences could understand. I couldn't do that without AI, so very grateful to learn that skill. To continue, all of these materials, including Steve's videos, revolve around the behavioral theories of psychological reactance and moral disengagement. Psychological reactance occurs when teens feel their freedom is being restricted, often leading them to reject directives like click it or ticket or don't text and drive. To counter this, we reframe safety messages as empowering choices. For example, instead of saying always wear your seatbelt, we emphasize that wearing your seatbelt actually keeps you in control, which gives teens ownership of that decision. Moral disengagement involves rationalizing unsafe behavior like believing I can text and drive because I'm careful. We address this by using relatable stories that highlight real-life consequences of risky behaviors, encouraging empathy and accountability. These concepts are critical in teen traffic safety because teens value independence and peer approval. By understanding these psychological mechanisms, we designed guides that encourage reflection and open dialogue rather than create resistance. For example, the student guide uses self-reflective prompts like, how does the idea of being in control while driving make you feel? Additionally, the parent guide provides conversation tools and, Additionally, the parent guide provides conversation tools to avoid power struggles, and the educator guide helps facilitate discussions that encourage critical thinking. These strategies empower teens to take ownership of their decision and prioritize safety on the road. There we go. So again, the goal of all these materials is to provide information without ever telling teens what to do. In the educator and parent guides, I provide a section that informs the adults of these theories, and in each model after, I provided, again, with the help of AI, scenarios and questions they can use to prevent falling back into a mode of questioning or educating that exhibits forms of psychological reactance and moral disengagement. The student guide is designed to help teens process and apply concepts for each of the video modules. They offer opportunities for reflection, discussions, and provide additional insights and strategies for developing safe and responsible driving practices. This is just a peek at the student guide. I did try making it informative and reflective, kind of fun for students. The educator and parent guides complement the videos and the student guides by reviewing what the students are learning and equipping them with the knowledge and tools they need to support their teen. These guides highlight key concepts and offer opportunities for adults to reinforce learning objectives at home or in the classroom. Additionally, the pre and post module questions provide students with an opportunity to internalize these concepts and apply them to not only driving, but their lives. An example of that questionnaire is on the right side of the screen. Just for reference, we are required to integrate foundational and concentration-specific competencies into our APEs, and these are the competencies I selected and fortunately met. For instance, one competency was to select communication strategies for different audiences and sectors. As mentioned, I did this by developing age-appropriate study guides for 3 different audiences. Another competency was to evaluate the nature, context, dilemmas, and foundations of public administration and apply learned skills to the field of public administration. Through Steve's guidance, I did this by integrating psychological reactance and moral disengagement theories in all of my products. These promote critical thinking and improve decision-making among teens. Traffic safety is both a public health and public administration issue, and And ensuring we have effective and equitable educational opportunities for teens is crucial. Through Steve's program, we have met this need, and it will be so exciting to see this program roll out. In conclusion, I'd like to thank Lee and Steve for their support this semester. This project challenged me to step out of my comfort zone, particularly in using AI as a public health tool. I now see how AI can actually enhance our work by making it more efficient and innovative. I also appreciate the opportunity I had to learn about the field of traffic safety. My personal expertise is in underage substance use prevention, so it was really fun to dive into this topic in this field. Again, I'm so grateful for all of you for being here today and supporting my classmates and I. Thank you again, and I'm happy to answer any questions.
Thanks, Reagan. Way to go. What an amazing group of students and the work that they've all done. I don't know about you guys, but I'm really impressed, this cohort. And I want to open it up to see if there's any questions for this amazing panel. Everybody's so, okay, well, Dr. Karinji has to everyone. Dr. McKay and I were emailing back channel about what awesome students we have. Nice job, everyone. Your presentations were excellent, and you were all working really hard on important areas of public health. Yeah, and I totally agree. I think all of the diversity and the different projects that you guys are working on and keeping it relevant and timely on these really important issues just gives me hope for the future. And I also want to take a big shout out, send a big shout out to our site mentors. I think a few of you are still on the call, and we can't do this without any of that, any of you. So thank you very much for working with our students and being a guide for them. And yeah, we really appreciate it a lot. So any other, here's another one from Dr. McKay. Great job, everyone, and many thanks to site mentors. So great job, you guys. Congratulations. I think it's really cool that we had two practicums on safe driving in youth. And I did not plan this. And I didn't even plan putting you guys on the same day. You picked yourself. So, and we look forward to hearing from you next, on the 16th, Steve Schmidt. I hear you're going to be with us. So that's,
Yes.
I'm looking forward to that. And thank you for yeah, all the hard work you have helped with our students this semester. We will be back here next week.
Lee,
Yes, go ahead.
this is Janet Trethway. I just wanted
Hey.
to make a shout out to Greg. We're actually in the process of updating all of the materials for our emergency medical dispatchers, and Greg's work has saved me hours. And
That's awesome.
we're already planning what he's going to do next semester to move this forward and improve care in Montana. So he's gonna it's really exciting, and the stuff the rest of the students are doing makes me want to go back to school again.
Come on over.
My husband would kill me.
We have a doctoral program. We have a doctoral program.
I already have one of those. That's the thing.
Oh, two.
I could do two.
It is really exciting hearing these presentations. And I think, Janet, thank you very much we love it when these are win-win, when the work that our students are doing is helping you out there in your professional life. And that's, and conversely, our students are getting amazing experiences with all of you experts out there. So we love to hear that win-win scenario. That's what it's all about. So thank you. Well, I think we did a very good job on staying on time and on task. And if unless anybody else has a last minute question or thought, please join us next week. I think we have 3 students presenting for our final cohort of the APEs, the Applied Practice Experiences. And otherwise, have a great Monday, and congratulations, you guys, for getting it done. Nice work.
Thanks for all your help, Reagan.
Thank you.
Thanks, you guys. Bye-bye.